So colorectal cancer, unfortunately, is an incredibly common illness. We have rates of over 150,000 people in the United States will be diagnosed with colon cancer just in the next year. Over 50,000 people will die from it. People have a lifetime risk. Men, 1 in 23 of developing colorectal cancer in their lifetime. Women, 1 in 25. And overall, the risk of dying from colon cancer is about 1 in 57, an incredibly high number. In addition to that, there are certain populations that have significant increased risks of developing colorectal cancer. There are populations, both minority, underserved, rural, and uninsured that have significantly increased risks of having and developing colorectal cancer.
The incidence is getting younger and younger. We're seeing people a lot more in their late 40s who've been diagnosed with colon cancer. Instead of what used to be people who are 65 or older. So the incidence is getting to a younger population. And that's why the screening recommendations changed a few years ago to reflect that, saying that we should start screening people younger.
Screening for colorectal cancer can serve a number of different purposes. Not only can it identify cancers early, which is extremely important. So when cancer is found at an earlier stage, stage 1 or 2, the chances for not only surviving but being cured of it are much, much greater, astronomically so, than if it's found at stage 3 or 4. So early detection has a huge impact on how patients do overall, and that's what colorectal cancer screening is all about. We also have the ability through other modalities like colonoscopies to actually prevent colorectal cancer from happening in the first place. So we can lower the risk of getting it by about 80%. We can lower the risk of dying from it by about 90%, which is incredible that we have a cancer that's that preventable and that treatable.